Hi everybody, my name is Terri Widdick. I'm a physical therapist with CORA Physical Therapy in Jacksonville, Florida. On behalf of CORA, I'd first like to say that our hearts go out to anybody that has been affected by COVID-19, either directly or indirectly. This is a challenging time for all of us, and here at CORA, we just want to provide you with as much service as we possibly can. If you can't make it into the clinic, we're trying to do these videos and bring you services like our new telehealth service where you don't even have to leave your home to speak to a therapist. Today, what I'm going to do is I'm going to talk about maybe some neck pain, some upper back pain that you guys have been developing from making your dining room tables into makeshift offices now. We probably don't have the best ergonomics with where our computer and our mouse and all of that stuff is, which is okay. We do the best that we can. We are going to have a video that's going to outline how you can kind of make your office effective for you so you're not developing these problems later down the line, okay, if this is prolonged. In the meantime, what I want to do is walk you through just some basic exercises. You don't need a lot of equipment other than a towel and maybe a tennis ball. And just something that you can do throughout the day. So if you're sitting on the computer 7 to 8 hours, and this doesn't just have to be if you're stuck at home, this can actually be carried over when we get back to our normal lives and get back into the office. So what I want to do is just start with just some basic range of motions of the neck. What you're going to do is just looking down as far as you can. So you're going to feel a stretch down the back of the neck, right? And you're going to hold this like 5 seconds or so, and then you're going to look up just as far as you can. Okay, so you can go back and forth. You can do that 5 to 10 times depending on how tight you feel the neck is. So the next one we're going to do is just rotation, okay? So looking over the shoulder as far as you can. Looking over the other shoulder. So you can do these exercises seated. You can do them standing. A good thing to remember is you want to just have good posture as you do them, whether you're sitting or standing, all right? So you can do that rotation maybe 5 to 10 times. It's good every hour, kind of just stop, stretch stuff out, and keep it moving, all right? So the next thing I'm going to do is I'm going to show you a little bit of the anatomy of the neck. There's a lot of muscles in the neck. A lot of the ones in the back, especially two in particular, are a culprit of a lot of our basic pain that we have in the neck. So I'm going to show you a few stretches. First, I'm going to show you the anatomy, and then I'm going to show you a few stretches that go along with those, okay? So this is all the muscles in the back here, and these big ones here. So this trapezius muscle, this big one, what we're going to do is we're going to focus on the upper portion of it. So that's when you hear the upper trap. That's the muscle they're referring to, okay? Then when you take that muscle off, so this half is with that muscle removed, you get to some of the deeper muscles, all right? So you find your levator scapula, which is right here, and that's attached to the top of the shoulder blade. So sometimes you'll notice that a lot of your pain comes from right in that area, and that's because a lot of the muscles attach in that area, all right? So what I'm going to do is I'm going to show you a stretch for the upper trap. I'm going to show you a stretch for this muscle, levator scapula. I'm also going to show you a stretch for the rhomboids, which are right here. And then we're going to do some strengthening exercises, okay? Another muscle that I want to point out is sub-occipital muscle, which is actually not on here. It's right here. So you have two little muscles at the base of your skull. They're sometimes challenging to stretch, but I'm going to show you a little trick with 2 tennis balls and a sock that you can get to these muscles here. Sometimes they're the culprit of what we consider kind of tension headaches, where the tension starts in the back of the neck and kind of works its way forward. All right. All right, so first we're going to start with the upper trap. So that big trapezius muscle that I showed you, we're going to start with the upper portion of it. So in order to stretch that, you're going to take one hand, you're going to put it behind the back. If you cannot put it behind the back, you're going to grab the side of your chair, just the seat that you're sitting on. If you're standing, you can grab something at like table height. You kind of have to just play with it to make sure that it's comfortable for you. So I'm going to do it with the hand behind the back. I'm going to take the other hand, I'm going to place it on top of my head, and you don't want to pull the head to the side. What you want to do is let the hand rest on the head, and what you're going to do is just let the weight of the hand bring the neck to the side here. So what you're going to do is feel a stretch right down the side of the neck there. So you're going to hold that about 20-30 seconds or so, and I like to alternate between sides. If you have one side that's tighter than the other, you can focus more of your attention on that side, but I like to just keep it even. All right, so that's upper trap. The next one we're going to do is levator scapula. That muscle is a little bit deep. It attaches to the top of the shoulder blade there. In order to do that, you're going to be very similar. You're going to put the arm behind the back or grab the side of your chair or a table. You're going to take the hand and you're going to put it on the head. However, this time you're going to put your nose towards your armpit, okay? So now you're at kind of an angle where it almost looks like you're smelling your armpit. And you're going to go down that direction. Again, you don't want to pull the head down. You just want the weight of your hand to bring the head towards the armpit. So you're going to feel this stretch a little bit further back than the one you just felt, but you're going to do the same thing. You want to hold it 20-30 seconds. You're going to do this 3 times. You can alternate. Good posture as you do it. Okay, so we covered range of motion, looking over both shoulders, looking up and down. We covered stretching the upper trap, stretching the levator, stretching the rhomboids, which was that muscle. Let me go back to the picture here. These muscles here, so the rhomboids. What you're going to do is, I like to stretch. You're going to interclasp your hands. And what you're going to do is just round your back forward, kind of stretching out that area. And you can do this 5 seconds or so. It's just a good stretch of those muscles in between the shoulder blades. All right. So range of motion, we did the stretches for those. Another important muscle is your pecs. So right in here, people get tight. And what happens is the shoulders kind of come forward. And then what happens is when you start to reach overhead, the humeral head is not in place properly. So what starts happening is you start to get your impingements, your rotator cuff tears, those kind of things. So it's really important to stretch this muscle out. All right, so in order to do that, you would, let me see, you can either do it in a doorway, you can do it in a corner. Let me see, I'm going to do it in my here. So pretend that the window's not there, but what you would do is put one hand here, one hand on the other corner, 1 foot forward, and you're just going to lean into the doorway. Or excuse me, lean into the corner. Okay, so you're going to feel a stretch across the chest there. Again, that one's good to hold for about 20-30 seconds, and we're going to do that one 3 times. So we did range of motion, upper trap, levator, we did rhomboids, we did pec stretch, all right? Let's move on to a little bit of strengthening. So one that I always tell patients to do, especially when you're on the computer, is scapular retraction. So that's basically squeezing the shoulder blades together, okay? So what you're going to do is just bringing the shoulder blades, I tell my patients, back and down like you're trying to touch your elbows together. What happens sometimes is that when the upper trap muscle, which is considered, it's called the big sister muscle. So when stuff isn't working right in the shoulder, this muscle comes in and starts overworking. It does everything. And that's when we get all the tension in the neck, okay? So what we want to do is let that muscle rest, and let's actually strengthen the ones that need to be working when they should be working. So again, you want to bring your elbows down and back like you're trying to touch them together. So you're feeling that muscle in between the shoulder blades. You're not having any tension in the neck when you do this, okay? You're going to do that 5 seconds, and we're going to do about 20 of them. I tell my patients it's good to do this every hour when you're working on the computer. Just something to get our shoulders back instead of here, where most of us unfortunately sit, okay? All right, let's see. What else is next? So we did the scapular retraction. So the last thing I want to run through, you guys, is with the tennis ball. All right, so a tennis ball is very handy for a lot of different things. My dogs are sitting here looking at me right now. So what I recommend is that you take the tennis ball and you put it in a pillowcase. Okay? What this does is your dogs now don't know you have a tennis ball, so they aren't staring at you as you do your exercises. Now it's in the pillowcase. Everybody can see that, right? So 2 things you can do with the tennis ball. You can take this and you're going to go up against the wall. So say you have some pain in between your shoulder blades. All right, so you're going to take the tennis ball. And another good thing is when it's in the pillowcase, it doesn't fall and roll all over the place. So even if you don't have dogs, I would still recommend putting the tennis ball in the pillowcase. But you're going to take that tennis ball, you're going to put it kind of where you have that pain, and you're going to go up against the wall, and you're going to kind of roll right on there. So what I tell my patients is that you kind of feel, it almost feels like a knife, and you want to kind of keep it there until it feels like a tennis ball. All right, so sometimes it takes a while. Depending on how tight that muscle is, you can roll around a little bit, but you're definitely going to feel it. So you don't want to put it on a bone. You don't want to put it on the spine. You want to put it on the muscles in between or kind of in the shoulder blade there, okay? So that's the release of the rhomboid area. That's a good one for that. So another thing you can do, and I don't have 2 tennis balls, but I will tell you the trick and you guys can try it. You take 2 tennis balls and I would say a tube sock would probably be your best bet, but you're going to take them, put them in the bottom of the tube sock right next to each other, and you're going to tie it really tight. So you've got 2 tennis balls sitting right next to each other. What you can do, and it depends on if you can lay on the floor, because you want a firm surface when you have these. But what we're going to do is we're going to focus on those sub-occipital muscles. So the ones that I showed you here. So they're underneath this person's skin right there. But we're going to use the tennis balls to release those muscles. So tennis balls are right next to each other. You're going to put them behind the head here. So you're either going to be laying on the floor. You can try this up against the wall. It doesn't work as well, but the 2 tennis balls, and what you're going to do is lay them right on the base of the skull there, and then you're going to lay on the floor. So the weight of your head is going to push against those tennis balls. And what happens is sometimes you even get referred pain into the face. That's kind of telling you that's really tight back there. And that's where those headaches kind of stem from. So using those 2 tennis balls on the base of the spine, or the base of the skull there, sorry, will help release those. So again, at first it feels like a knife. Then you want to do it to where it feels just tender in that area where the tennis balls. Maybe do it 3 to 5 minutes and then take it out. You should notice that tension in the base of the skull starts to subside the more you do it. Okay? So let's review. We talked about every hour we want to step away from our desk, maybe for 5 minutes or so. You want to work on range of motion of the neck by looking over the shoulders, looking down, up, just looking. You can either bring the ear, you can do those ones. All right, we talked about the upper trap and levator being 2 of the biggest culprits of that tension in the back of the neck. Stretch those out. Upper trap is ear to shoulder. Remember, you don't want to pull on the head. You just want to let the hand rest on the head. So we did, right, that one. Then we did levator scapula down towards the armpit there. So you're smelling your own armpit. Hopefully most of us have showered. So that one you want to hold 20 to 30 seconds as well. You can do that to both sides. If you can't reach behind your back, remember you can hang on to the side of your chair for that stretch. The other one we did was rhomboids, so stretching out that between the shoulder blades. Then we rolled up the towel. We put it behind the back. We put the hands interclasp and extend it back and held it 10 seconds, 10 times. If you can't put your hands behind your head, you're going to cross. Do it that way. Let's see, we talked about stopping and doing retractions. So remember, we don't want to do this. We want to bring our shoulder blades down and back like you're trying to touch your elbows together in the back. So you shouldn't feel any tension in the neck as you're doing that exercise. And then I showed you with the tennis ball. So the tennis ball up against the wall, the tennis ball so the two tennis balls in the sock, releasing those muscles. Again, we're going to show more videos here with ergonomics as far as how to set your computer up. What's good? Should it be, eye level? Should the keyboard be, where should the keyboard be? Things like that. So, in conclusion, if you guys have any questions, you can post them on Facebook and we will get back to you regarding any stretches, any questions, anything like that. A few things that I wanted to note is that, these are just for basic pains, okay? If you start to get symptoms like tingling, numbness, ants crawling on your hands, you're dropping items, just anything like that into the hands, you want to make sure that you're going to the doctor or you're getting in to see us. Anything. You just want to seek medical attention at that point. You don't want that to prolong. That means that there's nerves involved, and that's a little bit more serious than just muscle strain, okay? With that being said, CORA does offer what's called injury screens, and we're doing this via telehealth. So telehealth is a new thing where, just like you're watching this video, I'm actually going to be live with you, and you don't even have to leave your house. I'll ask you a series of questions. When did it start? This and that, and kind of walk you through some range of motion stuff. The injury screen is about 10 to 15 minutes. And then at that point, I can determine whether you would benefit from therapy, whether you would benefit to go see a doctor and get a potential x-ray, MRI, anything like that. Or we do offer direct access where if your insurance covers it, we can actually see you via telehealth or in the clinics. Our clinics are open. Physical therapists are considered an essential personnel during this time. So our doors are always open. I will tell you that our therapists are taking extra precautions. We all have families at home. So we want to make sure that we stay healthy, our families stay healthy, and most importantly, you guys stay healthy and your families at home. So if you're able to, if you can make it into the clinic, that's great. However, if you cannot, and if you're, stuck at home, we have services to get to you guys too. And, physical therapy doesn't just include manual therapy. A lot of this stuff, a lot of this education, a lot of this knowledge, a lot of this looking at you and your home setup. If you want to make sure that your setup where your desk and stuff is right, you can always, give us a call and set up a telehealth evaluation. So this is very easy. And please, if you like this video, if you like what we did here, please share it with friends, families, anybody that you think would benefit from either hearing this information. Every week we're starting to do this Monday, Wednesday, Friday via live Facebook. So these are going to be therapists that are right there ready to answer questions if you need them. So please do me a favor and like CORA's website here, their Facebook page, share it with your friends. And please stay healthy, and if you need us, please reach out to us. We are just here to keep everybody healthy, and we can't wait until this goes away and we can get back to our normal lives and treat you guys anywhere we please, in the clinic, via telehealth, whatever works out. So thank you for watching. If you have any questions, again, please post them below and we will try to get to them. Thank you.